Hello, today I'll be doing a periodontal probe on 4 different teeth. I have 8 lingual, 14 buccal, 24 facial, and 30 lingual. For my armamentarium, I have my PPE, which is puffy, face mask, safety glasses, and gloves. I have my Marquise probe or neighbor's probe if available, but I do have my Marquise probe right now. I will also have floss, dental mirror, and cotton pliers. I will have for my patient safety glasses, patient bib, and patient bib holder. For my periodontal probe here, it is my Marquise probe, and it is an assessment tool that is used subgingivally. It is double-ended, unpaired instrument. It has a flexible and simple shank, and it is circular in cross-section. It has a blunt and broad-shaped tip with no cutting edges. It is also marked and collaborated in millimeters, up to 12 millimeters marking, 3 millimeters increments, and it is used for assessing the health of periodontum, measure cal, measure recession, width of attachment, size of intraoral or extraoral lesions, any bleeding areas, to determine mucogingival relationships, and to monitor the longitudinal response of the periodontum treatment. I will also be using my mirror for retracting the cheek or indirect vision and indirect illumination. Since I have my typodont here, my typodont does not have any cheeks, but I will be using it for retracting the cheek as well. Here I will be checking for Fresnel, Volma, and this typodont doesn't have any cheek. For my Fresnel and Volma, I will assess and determine if abnormal muscle pull on gingiva and or short frenum. So I'll be checking my 7 frenums here. I'll be checking the sides. I'll check this one, and I'll have the patient lift their tongue up and check it, and then I'll check my maxillary frenels and check the frenel here. I will be also checking for mobility, and I will be checking for any recession, determine location of gingival margin to CEG, and recession will be recorded for any marking more than 1 millimeter. I will also be using my floss to check for any open contact. I will inquire if history of any periodontal treatment or gum disease, and or if they have any concerns with their gum tissue. I'll be retracting the cheek. Make sure it gets into the call. I have a 3, a 2, angle my probe, get it into the call, and I have a 2. Pretty healthy gums. Then I have a lingual. I will get in the call. I have a 2 and a 2, and I have a 3 here. And then I will be working on 24 facial. The other thing I will be also making sure to adjust my patient position, following mantra, having my patient move for surfaces towards, surfaces away as well, and follow the clockwise positions. So I have a 2 here, and a 2 here, and a 2 here. Next, I will be doing We'll have indirect illumination because I could see clearly. So I have a 2 and 3. And I have a 3 here. The next thing I'll be checking is mobility. I'll be doing tooth 14. And I do have class 1 mobility because it is less than 1 millimeter, so it is slight mobility. And then I will be checking open contact. I will be doing that for all 4 teeth, but there is short time today. See, shaped, T-shaped, and I do have tight contact distal, but lingual I do have a tiny open contact. I'll be measuring it, and I do have 1 millimeter here. The next thing I will be checking is also recession. There is no recession here. And then I will be checking for width of attachment as well. And for my application, no furcation, and maintain asepsis.